In this lecture, we're going to review a number of basic principles and guidelines when it comes to exercise testing in people at various stages of hypertension. And the key aspect of exercise testing is to ensure that people are safe to engage in an exercise program in such a way that it reduces the risk or mitigate the risk for the person to experience an acute cardiovascular event. But there are cases, situations where exercise testing is not considered to be required, and the person is cleared to go ahead and begin an exercise program. And that includes a person that is in a state where they are considered to have what's called controlled hypertension. And controlled hypertension refers to a patient with, or a person with, a blood pressure recording just under 140 millimeters of mercury over less than 90 millimeters of mercury. And these measures are consistent and delineates a close transition to what is considered to be uncontrolled hypertension that would begin a range of various treatments for that controlled hypertension. Now, although the values for blood pressure for pre-hypertension appear to be similar to those with controlled hypertension, so we see values ranging from 120 to 139 for systolic blood pressure, 80 to 89 for diastolic blood pressure. A person that is considered to be in a pre-hypertensive state are demonstrating signs that they are starting to trend upward into a consistent level of controlled hypertension and at risk for moving into uncontrolled hypertension. Individuals in these two categories that present asymptomatic and are considered to be free of disease, and that includes mainly other sort of cardiovascular diseases, other metabolic diseases, or renal diseases, or issues with the kidney. In these categories, individuals are cleared to begin the exercise program. Now, individuals that are physically inactive, and we'll define what physically active is here shortly, but those individuals that are physically inactive that do have controlled hypertension or are in a pre-hypertensive state may or may not be symptomatic. And so individuals that do not exercise or purposely on a regular basis are considered to be hypertensive or pre-hypertensive, controlled hypertension. If they are symptomatic or asymptomatic of these conditions here, these comorbidities, it is recommended that they undergo a medical exam and physician consultation as to whether an exercise test is warranted prior to beginning an exercise program. Now, for individuals that are already physically active, and these are individuals that have controlled hypertension or are in that pre-hypertensive state. Physically active individuals that have blood pressure recordings that would place them in one of these two categories, but are asymptomatic. But they're asymptomatic of signs and symptoms, but they have been identified as having a comorbidity. So either another cardiovascular condition, a metabolic condition, or renal disease. The recommendation here is that they undergo a medical exam and physician consultation if exercise testing is warranted. However, because these individuals are currently physically active, they may continue or actually begin light to moderate exercise prior to the consult. So we've talked about the difference between physical inactivity and physical activity, but what is considered to be a person that is physically active? A person is considered to be physically active if they engage in at least 30 minutes of moderate intensity exercise 3 days a week for a minimum of 3 months. And this is not job-related activity or activities of daily living. This is planned, structured exercise that people engage in. Now, those that are physically active and they have controlled hypertension or prehypertensive and are symptomatic of the signs and symptoms of either having controlled hypertension or being prehypertensive, and they have a cardiovascular, metabolic, or renal condition, the recommendation is that these individuals discontinue their exercise program and seek a medical consult that would likely recommend exercise testing that would include ECG monitoring to identify any contraindications to exercise. Now, with respect to exercise testing, there are some special considerations to keep in mind. And what we're going to do here is identify different stages of hypertension. And so what we're dealing with here is a situation where a person's systolic blood pressure climbs above 140 millimeters of mercury. So recall that the controlled hypertension or prehypertensive state is defined as a systolic blood pressure of less than 140. Stage 1 hypertension is when a person's systolic climbs above that 139 and into the 140 range, but it's less than 160. The diastolic blood pressure would record a value between 90 and 100 to be considered in stage 1. And so before a person begins exercise, and before they begin an exercise testing session, that a medical consult be carried out prior to this. Individuals with stage 2 hypertension are those that generate findings of greater than 160 millimeters of mercury on the systolic side and over 100 on the diastolic side. And because these blood pressures are considerably high, the recommendation here is that the person undergo medical treatment for this excessively high blood pressure, and they're recommended not to engage in exercise until this blood pressure is lowered. And the absolute contraindication to exercise testing occurs if the systolic blood pressure climbs up above 200 or diastolic blood pressure climbs above 110. And so even with physician supervision, this is considered to be an absolute contraindication to exercise testing. Now, individuals in stage 2 hypertension may undergo exercise testing, but that would occur after a physician consult. Now, to understand some of the concerns with exercise in people that are hypertensive, we begin by examining briefly here the physiological response to exercise. And so consider a healthy, normal blood pressure recording here. Recall that mean arterial pressure is the product of the central factors, which is cardiac output. This is a reflection of the heart, and the peripheral factors, which is the state of the vasculature, the total peripheral resistance. And so the normal exercise response, so as a person moves from rest into exercise, cardiac output will increase. And cardiac output increases by an increase in heart rate and stroke volume. So to make a long story short here, as a person increases their level of physical activity from rest in one session, their heart will start beating faster and their heart will start beating stronger, and that's illustrated in the stroke volume. The total peripheral resistance will decrease. And so not only is the heart pushing out more blood in 1 minute, that heart is encountering less resistance because there's a general vasodilation response around the tissues that have become more metabolically active. That includes the heart and the exercising muscles. And so what actually happens here in terms of the balance of these two factors that determine the product of mean arterial pressure, there is more of an increase in cardiac output. So cardiac output increases more than total peripheral resistance decreases. Therefore, mean arterial pressure will increase, and so will systolic blood pressure. That will increase. The reason systolic blood pressure will increase is because of this increase in heart rate and particularly stroke volume. So the heart's pushing out more blood more forcefully, and that's going to drive up mean arterial pressure. But during the relaxation phase, that pressure generated inside the cardiovascular system will tend to stay the same and may actually and slightly decrease. Now, the exercise response in a person that is considered to be hypertensive, we begin by taking a look at total peripheral resistance. And so where in the person with a healthy, normal blood pressure recording prior to exercise, the body would normally experience an increase in vasodilation. In a hypertensive individual, there would be less of a decrease in total peripheral resistance. And because there's less of a decrease, the diastolic blood pressure would tend to increase slightly. And the reason for this is that the blood vessels in a hypertensive individual would be less responsive to the stress of blood flow and less responsive to chemical signals from the metabolically active tissues to relax the smooth muscle and vasodilate. And so there would be there is still a decrease in total peripheral resistance, but to a much lesser degree than a person that has a normal, healthy blood pressure. So there's a lower total peripheral resistance reduction in the hypertensive individual. So this ends our this lecture here in the exercise testing principles for hypertensive individuals.